From WWL-TV, the spirit of Louisiana, this is Louisiana's news leader, Channel 4's Eyewitness Morning News.
March is Colorectal Cancer Awareness Month, and while this is a topic most people would prefer not to talk about, understanding colon cancer and the importance of getting a regular colonoscopy could save your life. This morning, Dr. Kevin Stevens begins a series of reports on colon cancer, today providing us with an introduction to the disease, and also there is a free screening that we'll be talking about as well.
Absolutely, that's correct.
Okay, let's first of all, let's talk about the colon cancer risk. Who is at greatest risk?
Well, if you have a history, a family history particularly, that's very important. If you have colorectal polyps, and a polyp is just an outpouching, a little, kind of like a pimple, if you will, a large pimple that's in your colon. Cancer anywhere else in your body, if you have breast cancer, particularly, you're at risk for colon cancer. A family history, as I mentioned, is another big risk factor, as well as something like ulcerative colitis. Ulcerative colitis is when you have real infection inside your colon, and you get white cells and diarrhea and all kinds of things that can happen with ulcerative colitis. And you would know it because you have the symptoms associated with it, as well as Crohn's disease, which is another type of colon disease that can cause you to have diarrhea and pain and a whole bunch of things in your colon.
And as you said, a personal history of breast cancer as well. And now let's take a look at the symptoms of colon cancer. And these would be later on that you would notice this.
Sure, and you know, that's why we are talking about this, because you can do some early screening to detect early. In fact, you can do a lot of things to prevent it. But one of the things that we're talking about is diarrhea, constipation, and changing your bowel habit. And that's a big thing, a changing your bowel habit. Other than if you change your diet, if you eat a lot of fiber and so forth, your bowel habits will change just by your dietary intake. So you have to make sure that you have just a abrupt change in your bowel habits.
And a blood in the stool would be something you need to investigate.
That's one big one. And you know, even the caliber of your stool. Sometimes if you have small stool, and so if that changes, that's very important. So you need to take note of what's going on, as well as an unexplained anemia, because what can happen is that you can lose blood in your colon, in your stool, and then that from a colorectal cancer or something like that. So that's why.
So you might feel a little tired.
Right. You could feel tired and just fatigue and abdominal pain, cramps, tenderness in your belly, increase in your abdominal girth, intestinal obstruction. All those are things that would tip you off that something's going on in your colon.
And weight loss for no explained reason?
Yeah, right. Again, hopefully your weight loss is due your diet and exercise and eating fiber and doing things we did last week, you know, where you can eat low fat and high fiber. But in the narrow stools is something I said earlier, the change in the caliber of your stool. Those are things that you can look at to make
and
sure.
These are the stages of colon cancer, and then there's the initial stage, very early.
Yeah, and that's just on the inside of your colon, and that's very important, because if we can catch it at that stage, your prognosis is so much better, because and if you go to stage 1, if you go to stage 2, you can see that cancer in the layers of your colon, and it goes on. And stage 3 and 4, it will spread to other organs and so forth, lymph nodes. That's much more hard and problematic to treat, because oftentimes if it's the stage 0, stage 1, you can just take it out and do a partial colectomy or whatever, and you can get rid of the disease.
The colonoscopy is something that we've discussed many times as being a way to find any polyps before they can become cancerous and zap them right then and there. And a colonoscopy, and we're going to be talking more about that, but there is a free screening that everyone can take part in.
Yeah, and the bottom line, there are 3 things that you can do to detect colon cancer. One is a stool for blood, fecal occult blood. And that's the free screening we have going on, because if you have blood inside your stool, that's a sign that something may be going on. You need to get it checked out. Number 2, sigmoidoscopy, where you actually go in the lower part of your colon, the sigmoid, which was right before the rectum. And then last thing is colonoscopy. And if you're over 50, at 50, you need to get everybody, we need to get a colonoscopy at the age of 50.
And before that, if you have it in your family.
Right, at the age of 40, we recommend that. So, but the main thing we have now is going on free testing for blood in your colon, in your fecal material, and that's, you can call this number. It's 897-8500. It's at Touro, and they will mail you a kit, and they'll tell you with the instructions what to do. How do you check your fecal material for blood, because if you have blood in your stool, then that's very problematic. We need to get it evaluated.
So this could very well save some lives out there. Call this number, 897-8500, to get that free cancer screening kit. And we thank you so much for being here. And we're going to continue this next week.